Hi, I'm Calvin Staples, owner and audiologist of Grand River Hearing and Tinnitus Center. Today I want to talk about children and hearing loss. As school is just around the corner, I thought it was really appropriate that we start to talk about how children hear and the impact of hearing loss on language learning and learning in general. Lately in Waterloo Region, I've seen an increase in the number of schools asking for a hearing test. And I think this is vital. It's super important because when we think about how children learn, they rely on their ears to understand instruction and to understand concepts and be able to focus on what the teachers are trying to teach them in the classroom. Sure, their eyes play a great role too, but we have to make sure that our children hear first to A, develop language, and B, follow the instructions within inside the classroom. Often the children that we see here at our clinic are coming in because there's a lack of speech development, or the speech maybe isn't clear. It usually comes from a speech pathologist, a doctor, a pediatrician, or even just a concerned parent. The causes of this can be many things. It could simply just be delayed in speech production, but one of the first stops is getting a good hearing test. Because usually, most children that don't produce or are unable to produce speech at the right time or the right rate will present with some sort of fluid in the ears or some sort of conductive hearing loss. Rarely is it a permanent hearing loss. It could be, but rarely is it. This conductive hearing loss can take on two forms. One, the routine ear infection that we all know about, where the children complains of pain and there's a red eardrum when we look in and there's usually some discomfort. The other one has no pain or no discomfort, no tugging or pulling at the ears, and parents would be completely unaware. A good hearing test will allow us to assess that and see whether hearing is contributing to that speech delay. So what are the signs that your child may be dealing with a hearing loss? The most common, and one of the ones that we've dealt with earlier, is just a delay in speech production or the number or clarity of words. Other signs are much simpler than that. Signs like turning up the volume on the television or the iPad or any sort of screen that they may have. Complain that their ears hurt or have some discomfort, some drainage out of the ears. Any of those things should be addressed. Other signs could be something simple as just inability to locate sounds, or speaking too softly or speaking too loudly. If your child is presenting with any of those concerns, a hearing test is one of the first stops that you should make.